Hello, you're listening to Ovarian Cancer Connect. I'm your host, Dr. John Nakayama. This podcast is sponsored by AstraZeneca. Let's get started. In episode 2 of this podcast series, HRD What, HRD Why, Testing Your Ovarian Cancer Patients, we're going to be talking about the evolution of testing in ovarian cancer. I'm Dr. John Nakayama. I'm joined today by Dr. Alex Olawaiye and Dr. Joshua Kesterson. Let's start off today's conversation by talking about how testing has changed ovarian cancer. Dr. Kesterson, how has biomarker testing changed your practice in the last several years?
Great, thank you. That's a wonderful question, Dr. Nakayama, and I think a chance to highlight all the recent developments, not only in ovarian cancer diagnostics, but also in ovarian cancer therapeutics. The steps made in diagnosis have been quite impressive over the last 5 to 10 years. You see this shift going from a histologic approach, where you put samples in a category based on a pathologist's recommendation, to a molecular approach, where you know that there are multiple drivers that dictate tumor behavior and multiple points of attack as far as therapeutic strategies that informs your treatment decisions. Previously, we didn't have this benefit, and we also didn't have the benefit of different agents that could be made more precise in their attack on advanced ovarian cancer. But with the advent of different testing and newer treatment options, I think those things have both spurred each other's development. We went from a histologic approach to a biomarker-driven diagnosis that can inform the prognosis and treatment implications going forward. So I think that it's very empowering to the physicians as well as to the patients.
I 100% agree. I feel like ovarian cancer is trying to catch up to some of the other cancers by becoming more personalized. Dr. Olawaiye, how do you feel about testing? Does it change anything that you do? Does it change how you look at the patients? Does it change how you treat them?
Information, they say, is power. The more information we can give to the patient about the process that is relevant to their disease condition, the more empowered they will be. So that's the first thing. The second thing is testing itself. It's not just testing for information's sake. It is testing that can be used to determine how we treat ovarian cancer and sometimes how the treatments are sequenced. So that is another very big impact that testing has brought to the table in advanced ovarian cancer treatment. Before, there was a very small proportion of ovarian cancer patients who underwent genetic testing. In my experience, because of the new impact of testing on treatment decisions, a very large number of patients are getting tested. We want it to be 100%, but we know it's not even close to that, but a much more significant number of people are getting tested.
That's totally right. We have to look for mutations in ovarian cancer. How does HRD testing stratify how you think about a patient?
I think anytime we talk about testing, when we talk about germline testing or tissue testing for HRD, it's a way to go from the unknown to the known. And by acquiring more data points, we're able to make better decisions. With the advent of newer therapies and with data generated from large randomized controlled trials, we're able to determine the best therapy for the individual patient based on their biomarker status. So we can see this as an evolution not only in the diagnosis, but also in the prognosis and the therapeutic treatment of patients with ovarian cancer. Additionally, I think every time we order these tests, we're adding to the database and our knowledge set regarding the optimal therapy for ovarian cancer patients.
The more testing we do, the more we're going to find abnormalities. I am testing all ovarian cancer patients, and that includes HRD testing.
I completely agree with you guys. This has been a great discussion. I hope you will join us for our next episode entitled HRD What, HRD Why, where we will discuss HRD testing and why it is so important.